My name is Barry Linder. I'm the president and CEO of ID Tech Medical and an ophthalmologist and engineer by training. And I'm very excited about this product, which we have developed, and it is called the Eye Lipid Mobilizer, or ELM. This is indicated for meibomian gland dysfunction treatment. There are a number of unique aspects that I'm going to review. First is this device, by design, is intended to be used first in the doctor's office, personalized to a patient's facial anatomy, and then brought home by the patient to be used on an ongoing basis to manage their disease by prescription from the doctor. The mechanisms by which this work are unique in that we have really 3 integrated mechanisms. And if I take this shield off, you can see a little more closely, we have 2 iPads, and each of these iPads conform very completely to the surface of the eye, a 3-dimensional topography. This is critical because the meibomian glands are evenly distributed on the upper and lower lids, 25 to 40 or so glands per lid, and we need to treat all of them. So this is eyelids closed, the device is customized to the face, the iPads move, the shield is then placed back on. With the shield back in place, this makes it a very approachable, consumer-friendly appearance, but it also serves a purpose of controlling the thermal environment. So if it's in a room with air conditioner or fans, we maintain a good control. So there are 3 integrated mechanisms of action. Number 1, we heat to lower viscosity of the meibum. Number 2, we use vibration that is tuned specifically to induce shear thinning of the meibum, resulting in liquefaction. And number 3, we translate the vibration to the bridge of the nose, where there's a branch of the 5th cranial nerve that induces some neuromodulation to get active expression from all of the meibomian glands of the previously liquefied meibum. In the treatment of evaporative dry eye, there are a number of strategies, and they typically start with drops, and the drops can be over the counter, they can be prescription, steroid, and so on. The issue is, number 1, it's a chronic disease, and number 2, evaporative dry eye isn't the lack of aqueous tears. So artificial tears are not truly treating the root cause. And they're also expensive, especially prescription drops. Alternatively, there are a number of treatments that are delivered in the doctor's office that are relatively invasive. And some of these involve putting something like a very large contact lens on the surface of the eye, pulling an eyelid over it, and kind of squeezing the lids. Alternatively, there's mechanical devices that go on the inside and outside of the lid, and you can heat and squeeze. So it's all very mechanical, trying to squeeze out the meibum. Comfort is a question. It's a chronic disease. You can't do a one-and-done treatment and expect that to be permanently effective, or you can break the bank with ongoing drops. So the approach that we've taken is one that recognizes the importance of an initial treatment in the office, and then the ability to take that device home, the ELM, and use on an ongoing chronic basis because it is a chronic disease. And to do that with a device that's effective, affordable, and therefore also convenient is the ELM.